with this Prasanna, smart evaluation of teleophthalmology with augmented reality and AI. Prasanna.
Thank you, Subudhi sir and Tosi for giving me this opportunity. So next we'll move into the metaverse in teleophthalmology. So this is something that is very upcoming and very promising, not only in telemedicine but also in telesurgery. I think these are a lot of promises which I'll be sharing. So once things which was thought to be only science fiction, right? I think many of us would have seen movies like this where it was thought as a science fiction. We are working extensively on making this a science-based reality. So we started with a smartphone application, and these are the two QR codes, one for the Android and other for the iOS. And how can we really have the patient's case sheet as a hologram, or rather, because eye being a three-dimensional structure, as you can see, it really helps in teaching to a maximum extent, but now we are slowly shifting towards working on a template so that we can have EMR or the patient's case sheet itself as a three-dimensional or a four-dimensional holograms. Here you can see the left-hand side and the right-hand side videos are synchronized. On the right-hand side, you are seeing the video that is actually synced with the phone, in the smartphone that is seeing. So on day one, if there is going to be a fundus imaging or an anterior segment imaging that is done, the templates that we have made, you get the holograms instantaneously. So the fundus examination or the anterior segment examination that you can see here can be done the way it can actually be done in the way we are seeing a patient, but the doctor and the patient may not be together at the same place. So we are trying to incorporate real fundus images. You can have any machine, Optos or EDON or CenterView eye care. So up to how many degrees that you are going to have the fundus imaging, that many degrees you can actually get it in the holograms. Similarly goes for gonioscopy as well. We have used photoreal visual reconstruction imaging to make the angle structures as realistic as possible, so that in the advent of angle surgeries and mixed surgeries coming up, so that also makes a huge lot of difference in selecting a patient whether we want to go for mix or we can go for a trabeculectomy surgery. Again, this is another patient's data. This is a recording from a smartphone. You can see that again, as I was speaking on angle, right? Whether we need to do a YAG PI or a YAG or a SLT or an MLT for that matter. And not only that, the fundus, you can see that this is a normal fundus. This is an NTG patient where there is a splinter hemorrhage, and the autofluorescence, the infrared, the filters can always be taken. The more imaging that we do for the patient, the more evaluation that we can actually do. This is again another patient's RNFL defect. It comes as a case sheet. So you can see that just like that on the left here, you can see the marker here. So the patient's data will be here, and you can see, you can choose different patients' data. As soon as it's being fed, you get the three-dimensional examination of a RNFL defect. And if there is a compliance issue, we can go ahead and do a trabeculectomy or a mix or whatever that the patient needs. So the data representation is what I'm emphasizing on, and we have validated it and published it in the European Journal of Ophthalmology, and this is the validation data of our study, which you can see here. And also we did do a commentary about this on how smart evolution of teleophthalmology can be taken forward, and it is published in the Indian Journal of Ophthalmology 2022 issue. And this is again another thing, we wanted to push ourselves more. Can we bring something called supractive learning? Because ophthalmology is something which is more supractive, right? We wanted to see structures that we wanted to choose. So on the left hand side, the augmented reality that we are working on, so we started using supractive learning. That means you choose which structures you want to subtract. The more imaging that the patient has, you can see the buttons on the left here. This is helpful for even neuro-ophthalmology as well. The brainstem, the brain, you can remove structures by choosing the buttons, and you can examine the patient as a whole. And similarly on the right, you can see we have worked extensively on the extraocular muscles. If there are going to be more imaging that we are going to do, the more we can reconstruct the patient's anatomy, and the more data can be extrapolated from the patient. And on the right hand side again, you can see a simple eyeball model is also opened up. So there are n number of possibilities and n number of models that we can have for an EMR or for an examination for that matter. Again, e-counseling and simple simulators. A paramedical person that we send on the field for a simulative learning. Look onto this left side video here. So this is a smartphone depiction. So by moving your phone forward, you can actually train them for a direct ophthalmoscope. So I'm just going back in this video. So I'm just again going forward. You can see by moving the phone forward, you can actually train them spatial orientation. So these are all very helpful for training our paramedicals, how you need to orient yourself. Your fundus can be used as a direct ophthalmoscope. So you train them as a hand-eye coordination, how you need to enter the pupil and visualize the fundus. So then when you give them a pocket fundoscope or even a direct ophthalmoscope for that matter, they really know how to go about it because they have been trained in space. Otherwise, we'll have to take a lot of teaching classes to them, how you need to go about it, and which are very cumbersome. So we are trying to accelerate learning so that these are all in smartphone. Everybody has a smartphone today. So can we do something with augmented reality, because every phone has this LiDAR technology, and we are trying to extrapolate it and use it to our advantage, how we can serve the rural community better. And now we are pushing ourselves more to telesurgery. So I got this idea from one of my mixed surgeries that I was doing. Again, these are the models that we already made. This is something that we push from 3 dimension to 4 dimension, where all the dimensions of the same that you saw on the smartphone can also be seen. Tomorrow you will have the patient's data and you will wear a headset, you can open it up, you can pull the OCT out and then see the patient as a detail. Like a diabetic patient walking in, fundus and OCT is done. So this is already possible, already done actually. This is no more a science fiction now. So the patient's database enters under 60 seconds, under no chart time. The OCTs also can be extrapolated out from the patient. You can see that the OCT slices can be extrapolated. You can see the patient for what they are, and we have also evaluated it and published it. So I think COVID really served a good push for me, because that is when I had more time to reassess and think about these innovations. Right, I was doing one MIGS surgery. I did the stent and it was superficially placed. No financial disclosure, but these are heart in the mouth movements because stents are very costly. So I had to reassess myself, place the second stent first, then I tried to retrieve the stent that got dropped. So, but when I was coming out, again you can see I was about to lose it in the phaco wound. So I had to reassess and then take it, then go ahead and then implant it. This is a very novel procedure which came to India in 2021. Not many surgical videos were there for teaching. So I went back to my drawing board, and in the headsets that we were using for diagnostics, so we went ahead and created a simulator. You can see that with this headset that we have innovated, this is in metaverse. The hands that he is moving, you can see it is coded in the metaverse, and it's a portable simulator and a very cost-effective one. Now, it is that you can take the stent, practice it 30 times, 40 times, or how many times that you want to, because these mixed surgeries, angle surgeries cannot be practiced in a goat's eye or in a cadaveric eye because the angles are collapsed, and not many models are also available. So every time the stent is placed well, a green light comes, and its 3-dimensional spatial orientation is clearly developed. The cognitive skills are developed, and you can go ahead and place the stent well. And we have also patented this innovation of ours. So, and also we ended publishing it as well, an immersive photoreal 3-dimensional augmented reality for mixed training. So these are all real and happening, and I think we are all going to work together along with the missions, and we are going to utilize human intelligence along with the mission, and this is another facet of us which will help the community, where humans can train the mission to pick up subtle findings, not only diagnosis, how we can predict what is an RNFL defect. So if you feed a fundus image, not only the diagnosis you can see in this image, even an RNFL defect can be predicted, so we can break the black box dilemma. We are trying to create explainable AR modules, explainable AI modules, so that black box dilemma does not play a role, and we have an explainable AI so that we diagnose, not only we diagnose, you can see along with diagnosis, the intricate findings are also arrived. See, maybe we need to spend 1 hour for an image training it, but that all comes back in a way that not only you get the diagnosis, now the machine gives where is an art exudate, where is a cottonwool spot, where is a neovascularization. So this helps us in developing an explainable AI, and that is the way forward, is what papers are coming out, and we are also coming out with our own data. And holistic AI, you can see that not only fundus, but you'll have to merge the OCT as well. In OCT also, if you're going to feed the left hand image, you will get the diagnosis and each single intricate findings. What is it? The way it is. A non-exudative ARMD, again a OCT of the same. So I think it's a very promising time, and again an exudative ARMD. You can see how much the machine gives you at the end, not only the diagnosis but also each finding. I think these are modules of us that we have innovated, and less than 60 seconds, most of it is in the alpha testing, and we are soon trying to launch it, and we are also evaluating it, validating it, and also publishing it. So we are going to work together between the doctor and the mission. We're never going to compete against each other. It's all for the better humanity. And I have my own startup called the Mahatma Center of Moving Images. You can catch me at www.mcma.in, and this is my team of ophthalmologists, optometrists, and technicians, and all these that I presented. we have created this. Thank you once again, Subudhi sir, for giving me this opportunity to talk on all my 4 innovations. Thank you once again.
Thank you. Excellent talk, Prasanna. So, very good. So, our next speaker is Dr. Sabyasachi Patnaik, Teleophthalmology setup. Prasanna? Yes, sir, please. Rajguru sir.
Sir, the financials, am I right, sir? So the apps that we have launched, the applications are actually now available to download free of cost. Even the ones that we use, the headsets, the application is now ready, sir. Every institute will be having their own headsets. It will be a Geo headset, it may be an Oculus, or it may be a HoloLens. So the application is, we have made the application and we have launched it. But now it is for each individual to download it and utilize it and see for whatever specialty that they are. So since I'm a glaucoma person, I started with making a mixed simulator and more of glaucoma related artificial intelligence. And my associate takes care of retina. So we are more into glaucoma and retina. I think it's now the individuals, they have to use it, give their feedback, and we can keep upgrading the models. Yes, sir.